Can you guys introduce mommy?
Spill the beans with Dr. Jail.
Hi, everyone. Thanks for joining on today's episode of Spill the Beans. As you might recall, we're in season 2, and this series I decided to bring in a bunch of my friends and colleagues that are in the medical sector. And when I thought of someone that was a little different and nuanced, I thought of this particular guest and would love for them to introduce themselves.
All right. Hi, everybody. My name is Laura Woyciesjes, and I am a registered dental hygienist. I have been in the dental field for 37 years, I think, if I'm doing the math correctly, or 36 years, and I've been a hygienist for 33 years. And I currently work for a local practice, and I've been there for 29 years. And earlier on in my career, I did a couple of years of teaching at the University of New Haven. And then I've also done some consulting with a firm out of Charlotte. And I've known Jill since like 2013, I think.
Yeah, it seems like forever ago. We've had a pandemic, we've had
Yeah.
lots of changes since then, but you're always someone that, in full transparency, whenever I have like a dental question, I text Laura. Uh,
Yeah.
and I thought of you because when I was doing a lot of research, I felt like people didn't talk a lot about the dental world, but really, I feel like I have a bunch of questions for you. So,
Bring them on.
have you ever heard of vicarious trauma before, like talking about it with me or reading anything that I do?
No,
No. Okay. And so when you went through school, did you have to take classes in like bedside manner or how to handle patients or any kind of conflict like that?
no,
Interesting.
uh,
And did anything for self-care at all?
definitely not.
Interesting. Okay. So then, and this is where I feel like maybe I just made assumptions, but when in the Title IX world, when we have students, faculty, or staff that have trauma, one of the resources that we give them is, options for grants and some support. And sometimes they need like tattoos removed or scars and plastic surgeons. And one time, I won't say what institution I was working at, but one time I had a student who had significant jaw injuries, and she shared with me that she told her dentist about her trauma, and the dentist was kind of like the best resource ever. And it made me think about other stories that you might have even not acknowledged that you heard, as far as like maybe domestic violence or childhood trauma or and I'm thinking, and maybe I'm saying too much about mine, but like I used to get TMJ. And in that conversation, my hygienist said, well, what are you going through? What's going on? And I just kind of unleashed. And I didn't think that they weren't equipped to handle it, but that's where my mind went. Do you have any feedback on those kinds of experiences?
I don't think we are equipped, but we definitely can become like a therapist for sure because we're spending an hour or so with a patient every 3, 4, 6 months. We are entering a very vulnerable space. The mouth is makes you very vulnerable. So once patients become comfortable with you, they can definitely share things. I've heard lots of different stories over the years. And yeah, I don't think we're definitely prepared for it, but we just sort of work through it when it happens.
It's
And
interesting too, because you would think that you don't talk a lot when your mouth is open, but the
I can talk a lot.
conversation, but you do because, and I know that from my own experience, when I go in, the first thing she'll say is, what's different from the past 6 months? And so it's almost like really quick kind of trauma dumping that I'm assuming happens, whether it's, hey, I just went through a divorce, or, why did your insurance company change? Oh, I had to get a new job, and stories come out.
Mhm.
So I do think you're hearing the stories.
Oh, definitely. Definitely.
You have 37 years experience, Laura. What do you do that has helped?
Um, well, I think I did things differently early on than I do now because I've aged and I've matured and I'm, you know, more seasoned, I guess you would say. But after you've treated a patient and it's not been, a good experience, I think when you're making your notes in your chart, you can kind of like process it that way. And then you have to move on to the next patient in the next room and start all over again. But definitely massage therapy,
Yeah.
taking naps, taking walks. I started volunteering like 4 years ago on one of my days off, and definitely working less. I'm fortunate that I'm able to work less. I don't have to work full time. I work 3 days a week, which is plenty on the body at this stage in the game. It's a very physical profession. But yeah, those are some of the things that I do.
You worked during COVID?
Oh, yes. So we closed our office on St. Patrick's Day in 2020.
Mhm.
And um, we were like, okay, see everybody in 2 weeks. And that 2 weeks turned into 2 months. And I'd never been on unemployment before.
Mhm.
So it was a very scary time for sure.
Mhm.
I made a list of things to do around the house, and I think I finished it in like 3 days. And I was like, oh boy, I have to find something to do because my
Right.
husband was working from home at the time. So,
Mhm.
um, yeah, so those 2 weeks turned into 2 months. And then my first day back, we kind of split up into teams. So like team A was on 3 days, Monday, Tuesday, Wednesday. Then team B was Thursday, Friday, Saturday. We were working 10-hour days. And with all the new PPE, it was definitely a challenge. Like the first day that I worked, I came home and I cried. And I'm not a crier. I just remember all of the anticipation and then what exactly happened and things we weren't able to use that we were able to use in the past that we couldn't because of aerosols. But we definitely adapted, and I was not nervous to treat my patients. I, over the time, was more apprehensive about having lunch in the lunchroom without a mask on, and my coworkers, who went out over the weekend and who's not really, being careful. And so
Yeah.
I felt protected treating patients.
So there is a couple questions that my mind is going to about like your direct impact of trauma would be like PTSD. So like your anxiety, your feelings, your emotions of what this means directly for me. And then again, I have to make an assumption that there was some trickle secondary trauma of students, faculty, staff that I experienced would be patients for you. That your patients come back and say, this horrible thing happened during the pandemic and that you're hearing that story as well as you're living with the PTSD potential.
Yep. I had a patient whose husband passed away from COVID and she couldn't even attend his funeral. She had to watch it on a live stream. And it's
Right.
just like heartbreaking to listen to that.
Right. And I feel like because they are your patients, that like doctor mentality is there. Like this is someone that I can confide in versus like an administrator in higher ed, right? The other thing that I was thinking about when you were talking about your COVID experience is just so again, the correlation in higher ed, we had a lot of challenges between the policies of people being vaccinated. Did
Mhm.
that, did you have a personal opinion about the vaccines and then a legal requirement within the job? And then, like, where did you feel, were you being supported in those initiatives? Is that a level that we're not even discussing because that is
Yeah,
all vicarious trauma, right? You don't make
yeah,
the policies,
right.
but you have to execute them. How did you?
So I got vaccinated in December of 2020. I was like, sign me up. Where do I go? Like, I was like, give it to me now. I was so ready for it. And in my mind, I was like, everybody should get vaccinated because then we can get back to normal. And
Sure.
there were people in my office that were like not wanting to get vaccinated because they hadn't had children yet and they weren't sure if something was going to affect that. And I was just like, let's go, let's just do this. And then we also got trained as hygienists to administer the vaccine because we're allowed to administer local anesthesia. So I went through that training in January of 21. I never was able to actually administer. I was never asked to do it. But yeah, I was, and we also were asking patients their vaccination status. And there were a couple of patients that I can think of right now that were like highly offended, didn't want
Mm,
to answer the question. So that kind of told me the answer right then and there. But yeah, I was definitely like, get me vaccinated. I just want to get back to normal. And I did well with all the vaccines that I received. I typically do well with vaccines. So,
yeah. Well,
um,
I'm glad that you were okay, but I do think that that is an area where we have to process how you felt and other practitioners felt in that space because again, you're delivering the message. You didn't create the message and you agreed with the message, but it has nothing to do with if you agree with it or not, right? It is what it is. In order for the office to function, they had to have their vaccines. And
Well, since I work for a private practice, I don't think, I mean, it was highly encouraged, but it wasn't like, if you don't, you can't work here because, I don't work for a hospital system. So it's a privately owned dental practice. So I don't know that we could have mandated. I
yeah,
mean, I pretty much think everybody did at the time.
yeah.
I don't know about now, but
So you had some flexibility, which gave you that space, but yet there were still these difficult conversations.
Mhm. Yeah. And
Wow.
now at this point, I don't even bother asking
Yeah.
anymore. If I see it in the medical history, I just delete it because it's like, that was 4 years ago or 5 years ago. It doesn't really
Right.
matter now.
Wow. It seems very heavy to me from an outsider, like because I don't know, to your point, when you went through your schooling, there was not a lot of attention for you of how you're dealing with this. And then the job that you signed up for 37 years ago has dramatically changed. So, and I know that when I initially reached out to you, you were kind of like, I don't know if I'm the right audience. I'm like, 100% you
Uh,
are.
and then I was doing a little research. I'm like, oh my God, I totally am.
So let's shift it a little bit. We did talk about like strategies that you use. Have you found that any of the other protective factors that I discussed as far as like talking to um, a partner, being able to be transparent about your workday, is that something that you practice or that you
For
think would
sure.
be helpful? You do?
I do, but I have to say sometimes I come home and I don't want to talk at all because I've been talking all day and I've had, if I've seen 8 patients, I'm having 8 very different conversations in a row, and then I'm interacting with my coworkers and I'm like, I just don't want to talk anymore. When I get
Yeah,
home, I just need
right.
like a minute to like decompress. And I
Yeah,
don't have a long ride home from work, so it's not like I'm decompressing in my 3 mile ride.
right. Yeah, that's a good point too. The decompression is really important. The other thing that I was thinking about for you was this idea that some people don't like going to the dentist. This
Oh, a
is
lot
not
of
a surprise to you,
people.
right? Like I'm not okay, I'm not like
Yeah.
telling you something you don't know. Um, it's been my experience that sometimes when I work with people and they say that they're not open to talking to a counselor, they typically have this horrible story of something that happened to them. When you have a patient that doesn't love going to see you, do you ever talk about the why and learn about any past trauma as well?
Usually they will come forward and say, I don't like because of this or that, or I have one patient in particular that had some kind of trauma, and I don't know if it was the dentist did something inappropriate or there was something. I can't put my finger on it, but she will come in, like I will get her in the waiting room and she will start crying like on her way down the hall. And I
Mm,
just know to expect that every time. And we've never had an issue with her. Like I haven't. And she trusts me and she still comes. So it's interesting how somebody can have a traumatic experience and then you've seen them for 5 years in a row and everything's been fine, but they're still
yeah.
on edge
Nervous.
and
Yeah,
crying
right.
when they come in to see you.
I think that speaks volumes for the environment that you've created of, them returning to be your patient, but then also giving them permission to have that release. I commend you for that. And without any formal practice, you are creating all the best practices that we would want. And that's amazing. What recommendations do you have for those that want to be you, like want to be in your profession or starting out? What recommendations do you have?
I think one of the recommendations is to not do it full time if you can help it, and to be very mindful of posture,
Mm,
um, things that were taught in school, but I didn't necessarily follow the rules, and now I'm kind of paying the price this many years later.
yeah,
Um, and to also, if somebody doesn't want to participate in their dental health, you can't convince them. You can't want it more than they do.
yeah,
So things that I'm learning as I get older, I can't care more about the health of your gums than you do. I could tell
right.
you everything, but like you can't like take it all on yourself.
Right. And I would think that you would also want young professionals to maybe focus more on the things that you now are doing for your self-care. That if it's not in their curriculum and no one is talking about it, you've lived through a pandemic, you've had all these experiences, and you are saying, I now put myself first. I also do these self-care strategies. And even if I didn't learn it in school, it's the lived experience.
Right.
Yeah. Well, we appreciate you more than you know. You help the profession in general to be a place where patients can go and take care of themselves. And I have every guest say, if you had to spill the beans with one quote or one phrase or one word, what would it be? I pass it to you, Laura, to share with us anything that you want to share.
I say to please take care of your gum health. Connected to your overall health. So yeah, when we're saying to please floss and to do all these other things, it's not just because there's a definite connection. So you'll be
Oh,
healthier
yeah.
and will feel better.
So I'll leave you with that. That is such a true medical professional that the advice is about our gums. I would say to be kind to your hygienist because it sounds like Laura is validating what the research is saying. What I assumed is happening is that we are using these amazing practitioners to share our burden, and they not necessarily learned about it and are learning through us on how to take care of themselves. So let's be kind to them as we're kind to our gums as well.
Yes,
So.
exactly.
Thank you all for listening today. See you next time. Hi, everyone. Thanks for watching today's episode of Spill the Beans with Laura, my favorite dental hygienist. So, a couple of things that I learned that I did want to share with you that she didn't get to talk to you about. Laura was someone that from early on meeting with her, I noticed that every 3, 4 months she would go on these trips. Her and her partner would go, out of country, different states, and I was always very envious of her traveling. And I remember talking to her once and her saying, my job requires me to really be present, and this is my reset. And I always admired that. And I do think that without Laura knowing it, that was a protective factor that she built for her success within her profession. The second thing that I always admire about Laura was her sense of giving to others, whether it was a fundraiser that she asked me to contribute with or just her sense of community. And I think that the lesson there is that even though no one taught her about vicarious trauma, she knew that she needed to fill her cup in other places other than work. So, lots of wisdom from Laura. I so appreciate the candid conversation. And again, encourage you to, as you're taking care of yourself, be mindful of the professions that you're in. You might not have been taught that you're in a helping profession, but I guarantee that the more that we talk about this, the better tools that you will learn to manage your vicarious trauma and prevent burnout. So thank you for joining today. Bye bye.